Okay, Assalamualaikum. Hello, everyone.
Hello.
Hi.
Today, how do you do today?
Alhamdulillah, everything's good.
Okay, so for today, we would like to share a knowledge about our global issue nowadays. So for
Okay.
me, I think everyone in this group is know about COVID-19 issue. Is it right?
Yes, right.
Yes.
Okay.
So this sharing is only to discussing about our knowledge and opinion. How about COVID-19 spread around the world? So for the next, before this discussion start on this session, allow me to make an introduction about my team member. My team member is consist of 5%. Firstly, let me introduce myself. My name is SUFIAHNAH binti Mohammed, and the next candidate is Mrs. DENASIA TUNAI. Hello, Mrs.
Hi,
How do you do today?
I'm fine. And
Okay. So next to her is Mr. Nazrie BOHARI. Hello, Mr. Nazrie. Assalamualaikum.
Hello, Waalaikumsalam.
How do you do today?
I'm okay.
Okay. Then the next is our handsome guys, Mr. AK MUSFIRAH. Hello, Mr. AK.
Hello, Sufiahna. Hello, everyone.
Hello. Hello,
Still single,
everyone.
huh?
And then
Yeah,
still
yeah, single.
single.
Sure.
Okay. The last candidate is Mr. SYAHRIDON HERMAN. Hello, Mr. SYAHRIDON.
Hi.
Assalamualaikum.
Waalaikumsalam.
So, hello everyone and welcome everyone to our discussion today.
Thank you,
Okay.
Miss Sufiana.
Thank you.
Okay, can we start our discussion?
Yan.
Yeah.
Okay. Get ready everyone. So everyone, our main topic today is COVID-19.
19.
Nice
Yeah.
one. Global issue of
Something
COVID-19.
The
so
current
this
issue.
is this is something that familiar to all of us in this group. Is it?
yeah,
Right.
true.
Yeah, true.
Yes.
Agree.
So what do you opinion about COVID-19? It's something big happen in our world around the world. Is that right?
Yeah.
Yeah.
COVID-19
Yeah.
is so scary.
Scary. Okay, so let me introduce. Firstly, I will discuss about what do we know about COVID-19. I will explain to all. I will show what my opinion.
Yeah.
Secondly, Mrs. Denasia will talk about what her opinion on effort which government did to break this pandemic issue. So the next one, thirdly, Mr. Nazrie. Mr. Nazrie will talk about the others way which are supposed to be done to break the chain of COVID-19. And then the next, our handsome guys, Mr. AK,
Yes, I
will
am.
will discuss about the reason why the import cases is always increase so fast in daily nowadays. And the last one is about Mr. Sheridan. Mr. Sheridan will clearly explain to us in the end of this discussion about is it reasonable when government restrict our national border during this period. So all of us is okay about the issue, is it right?
Yes, Miss
Okay.
Sufiana.
Okay. For the first issue, let me continue with our first issue. My issue is sharing about what is COVID-19.
Yeah, keep going, Sufiahna.
Is it virus? Is it similar to virus? So what actually virus COVID-19 are? Okay, that is my issue. As we know, Chinese is the first country that have a record of case for this pandemic. health issue. And for my opinion, the reason why this virus is spread rapidly to all country is it's through their tourism sector, which is help country that not block the entry of foreign tourists in their country. So that is the one of the reason why the COVID-19 spread fast in the world. Is it right?
Yeah.
Yeah, of course.
Yeah.
So this problem also happened in Malaysia. The first case in Malaysia was recorded is on January 23, 2020, when the Ministry of Health received a report of 3 cases that suspected of being infected in Sabah and Selangor. But I believe Malaysia is in good condition today because government always take fast action to prevent this virus from continuing spread.
Excuse me, Sophie.
Yes, Mr. Eke.
Okay, I'm sorry for interrupt. Okay.
Okay.
For me, I agree and totally agree with Miss SUFIAHNAH opinion on about the spread of COVID-19 in Malaysia. And if
Yes.
we see through the Malaysia press and social media, Malaysia is
Yeah.
the one of the earliest countries that get successfully control COVID-19, right?
That's
And
right.
it's
Yeah, right.
and it's really spread. The Ministry of Health Malaysia, that led by Dato' Nur Hisham, the
Yes.
plays a very good role in monitoring this pandemic issue of COVID-19 in our country. And I think our Prime Minister, Minister Tan
Yes.
Sri Muhyiddin, yeah, sorry, Tan
Tan
Sri
Sri
Muhyiddin
Muhyiddin Yassin.
Yassin, yes, uh, did a very good job for us.
Yes.
Yeah.
He
Yeah.
did a very good job.
Yeah.
Thank you, Mr. Kemus,
Okay.
for the good sharing. So let me continue.
Yeah,
So,
sure.
so can I continue?
Yes, please.
Yes,
Yes.
definitely.
Please. Okay, thank you. So, let me continue about the COVID-19 that we know as a virus. So, everyone, virus is something that very tiny particle that cannot be seen by human eyes. They cause illness, including the flu. So there are many type of virus, and each type can have many versions. So the coronavirus is type of virus. Then COVID-19 is disease that caused by specific version of coronavirus called SARS-CoV-2.
Excuse me, Miss Wu.
Yes, Mrs. Denisha.
Sorry for interrupt you. I have a
Um,
question here.
okay.
How coronavirus can spread through air?
Oh, okay. Coronavirus is known as a virus. So virus can float through the air and it survive in water or even on surface such as our skin. Sorry. And some virus survive for just a minute, while others can survive for days. When people have COVID-19, they can sneeze, cough, or breathe out tiny droplet containing the coronavirus into the air. And this droplet can stay in the air for a while. So when you breathe in this droplet, you can become infected. The virus also can get onto someone's hand. Meanwhile, the hand can transfer the virus to the other hand. So if you touch your face, your nose, your eyes, your mouth, your hand, the virus can get into your body. Meanwhile, we can have COVID-19 and not knowing it. So just wearing a mask to prevent you from sneezing, and just do a social distancing, and just remember that this virus is moved very quickly and easily between people. So that is for me. The opinion about COVID-19 is a very general, but we will be more about this. So I will invite Mrs. DENASIA tonight to explain about her
Sorry,
sharing.
sorry, Miss Sufiana. Should
Yes.
we wear
Yes.
should we wear mask now?
Doesn't need to wear just now because we are online. So
Yeah.
the social distancing is always there. Is it right?
Yeah.
Do you
Sorry,
need to?
not very well.
Oh,
Okay. Okay.
are you
So
coughing?
Mrs.
Yeah.
Denasia.
Right. Okay. Thank you, Sufiahna. Before I start my issue, I have one question to ask. What are the government's sorry. Do you all know the three main components implemented to handle and manage the threat of COVID-19?
Not
Nazrie?
really.
Any idea, Nazrie?
I think prevention, containment, and controlling.
Oh,
Is it right?
Nazrie. Yes, exactly, Nazrie.
Take applause.
The three
Okay, thank you.
components implemented to handle and manage the threat of COVID-19 were prevention, containment, and controlling. It is a wise decision, good timing, and proper way that should be praised. Movement control order MCO by the police, military, and other security forces should be commended for being able to control civilian movement and prevent COVID-19 virus from spreading. Although the MCA is costly and has an impact on the economy, it is the most appropriate and necessary way to curb COVID-19. One more question from me. What are the government recommendations to break the chain of COVID-19? Sufiahna, any idea, Sufiahna?
For me, I think firstly maybe the society should be carefully and always wearing wearing face mask and face shield, especially for the kids, and just keep
Yeah.
social distancing 1 meters to avoid the droplet of virus in the air to spread to the other people around them.
Okay, I agree with you, Sufiahna. The government encourage people to wear face masks, keep social distancing of 1 meter, perform screening tests to detect infection, wash their hands frequently, and living a healthy lifestyle in dealing with the outbreak. And not forgotten, stay at home. Jangan kesana kesini
kesana, kesini,
our PM
kesana.
had insisted that. Do you all
That's
remember
right.
Yeah.
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 There's a music about that, right? There's a remix about that.
that?
That's a lot of
Go to
info.
bed. Take 1 to 1.
Pandemic COVID-19 is a warning sign that shaken the world for mankind to start thinking and did something right. If we ignore the warning, it will endanger ourselves in the future. Is it?
Yeah, good.
Yes.
Yeah.
Yeah. That's all from me. Now, let's us all listen to Mr. Nazri's opinion about the other ways which are supposed to be done to break the chains of COVID-19.
Okay.
Nazri,
Nazrie,
your turn.
please.
Okay, thank you, Kak Denasia. Okay, the other ways which are supposed to be done to break the chains of the COVID-19, first you must wear a mask that covers.
Sorry, Nas. Nas, slowly. Nas, sorry.
Excuse me, Mr. Nazri.
Mr.
Maybe
Nazrie.
there's some
Mr. Nazrie.
problem with her is with the
With the
Never mind, cut. Never cut nanti lah.
Yeah.
Something wrong with the
Yeah, it's okay. We
mic.
just speak. Mr. Nazrie, sorry, we can't hear you. Mr. Nazrie,
Yeah,
can
Yeah,
you
Mr.
hear
Nazrie,
us?
sorry. Connection problem maybe.
Yeah, we have her. Mr. Nazrie, Mr. Nazrie,
Mr. Nazrie.
Hear me?
we can't hear you. Repeat again. Sorry.
Repeat
Yeah,
again,
he-
Mr. Nazrie. Please repeat again.
You can hear
Oh,
me.
sorry.
Internet connection.
Yeah.
Repeat again.
You must
Wait again.
we wear a mask that covers both the nose and mouth anytime you leave home. But experts in the US and globally now recommend that everyone wear cloth mask covering both your nose and mouth when not at home. If you COVID-19, even if you don't know it, a mask prevents you from infecting others. It may also reduce the amount of virus you inhale. To work properly, must have to cover both your nose and mouth. Second, uh, physically distancing. Stay
Oh,
at least 6 feet, 2 meters from other people, except people you live with. Physically distancing reduces the chances that you will get in the coronavirus or that you will give the virus to other people. Since people can have the virus even when they seem perfectly healthy, stay at least 6 feet, 2 meters away from everyone who does not live with you. Unfortunately, no hugs or shake and either. Okay, and three, wash your hands frequently and thoroughly. Okay, you can get coronavirus on your hands without knowing it. Washing your hands and thoroughly with soap and water reduce the chance that you will get COVID-19 or give it to someone else. Okay,
okay.
lastly, I think avoid go to crowded places.
Yes, right.
Coronavirus spread more easily in crowded places. It is either to stay 6 feet, 2 meters away from everyone else. Being around more people increase the risk that at least one of them has COVID-19, even though they may not know if crowded place safer if everyone wears a mask covering their mouth and nose, but physically distancing is still important.
That's right.
Yeah.
But
Distancing is important, right?
This is
Yeah,
my
it's very
opinion.
important.
So I have a question
Yes.
to Amos.
Yes, I am.
Which country ranked the highest for COVID-19?
Highest COVID-19. United States.
Yes,
Yeah.
right.
Why?
Almost 4 million.
I guess it's America, doesn't it? Is the wrong answer.
I think the answer is right.
But that's it's right. Okay.
but maybe the
Okay.
top one is the United. Is it?
Yeah,
Yeah.
United
Right.
States.
United States. Okay.
Sophie, I have one more question for you.
Yes.
How do you prevent the COVID-19?
Okay. Based on you.
Guys, sorry. Latest
Yeah.
information as at 14 March 2020, I
Okay.
checked in COVID-19 government.my. It's Italy.
It's Italy. No. So the new report is Italy.
Italy
The
is number
ranking.
one.
Yeah, number one is now
Highest
Italy lah.
ranking.
Yeah.
Oh, the highest ranking is Italy. So the
Is the country total cost of COVID-19 highest in the world has been as at 16 July lah. So Italy will be the first 21,015, and then Iran 12,007. Maybe I can share with you guys. Wait, I'll share you the website that I found it. Sorry for interrupt both all of you. You can still hear me?
Yeah. Yes,
Yeah.
yes.
But maybe that's
Wait,
the
here. This is the website that I found it. Italy, Iran, Spanish, French, German, America, UK, and then all been slowly lah.
Oh, okay,
Like-
okay.
like
Thanks for the
for-
info, Mr.
Like
Sheridan.
from Malaysia, Asian. This is for Asian. You can see on the right hand
Oh.
side is for the Malaysian.
Okay.
Malaysia, Singapore, Thailand. For Asian lah, we still the highest one lah. Singapore, Thailand, because if I'm not mistaken, as of today, we just have import cases into Malaysia. Okay,
Oh.
proceed back to who? Is it
So,
Kira?
Mr. Nazrie, question to me.
Sorry, Nazrie, sorry interrupting. Okay, carry on.
So we proceed to the for the question that Mr. Nazrie asked me. So based on his talk about how to prevent this COVID-19, actually first always use your hand sanitizer.
Yeah.
Keep your
Yeah.
social distancing. Take a bath first when you come back home from outside. And the important thing, just stay at home if you doesn't have anything to do outside your home.
Okay.
Okay.
Thank you.
So the next, I please, Mr. Handsome guys. Mr.
Yeah, thank you.
Mr. Kibusya.
Thank you. Okay. But before I start, I want to ask Mr. Syahridon.
Yeah, Mr.
Okay,
Sheridan.
it's about what? Wow, you make me
Yeah.
scared, man.
It's not issue, but I want to ask you, you have already checked your go to hospital because I'm here, you're coughing over and over again.
Yeah, having went to the clinic. Alhamdulillah. Just
Alhamdulillah.
just a fever, just the normal fever
Just
like
a fever.
couch. Yeah,
Oh,
because
okay.
we are not exposed. We are not exposed to out from Sabah, so it's not COVID cases lah.
Okay.
That's
Ah.
good. Okay, so hi everyone.
Bye.
Hi.
Before that, I just want to highlight the total of cases worldwide ended yesterday. Not today, that yesterday.
Okay.
So,
Yesterday.
yep, yesterday.
All
10
right.
million. The 10 million
10 million.
3,638 total cases, which is 581,560 death cases with 210 countries involved. No, 210 countries involved. So from the overall cases, Malaysia have 8,734 cases, which is only 0.06%. Okay, and this before that, just disclaimer, this is only my point of view, why and the reason of imported increase so fast. Okay.
Oh, hey guys, wait.
Yeah.
Dropping once again. I need to show you guys this. I just found it. My information earlier is not correct because let me show you. Sorry. Because
Right.
your information is really true. All right. Let me show the website again. Sorry, you can
So
see actually
that
there
is
is a
the
play button here.
important sharing info
Yeah.
to others, right?
Yeah, there is a play button here. I just found it. You can see here play button. So it's moving. I make it fast lah. All right. Okay. So June. All right. So the end is 16 July. So this is the final one lah.
Final one.
Berapa million? How many millions is it?
Is it right? I see yearly it's America. That
Yeah, true. The Americans is number one.
America now is number one.
Okay, sorry, we go to Asian country, blah blah blah. So Indonesians is number one lah.
Oh,
So
okay.
this is the latest one report lah. The new report.
You know, we are noob. You know noob? The new guys in internet using all this.
Never mind.
Indonesian, Philippines,
Oh, it's okay.
Indonesian, Philippines, Singapore, and then yes, we are. All right. Come back to
Yeah.
Mus, please.
Okay.
Okay, Mus, please continue.
I continue my issue. Okay. So for me, this is my point of view. Why and the reasons of imported case increase. Maybe first of all, lots of old people. You know, I took Italy for the example,
Okay.
which is Italians have the sixth longest life expectancy in the world, which is average 84 years old. And as we know, medical researchers have said the coronavirus poses a more serious threat to older people than youngest one. So
Okay.
you all know why? Because the older people have less immune to fight any virus than the
Yes.
younger, right? So
Right.
that's why older people are more likely to contract the COVID-19 disease and mostly to have a more severe case of it. And
Yeah.
we can see in Malaysia daily report of COVID-19 by our Ministry of Health. Average new cases and death cases from older people is so majority, right?
Yeah, that's
Uh,
right. That's right.
Right.
so the
Majority is all
second,
people.
yeah, all people. So the second maybe because close proximity. You know, close proximity. Close
What is
proximity.
it?
How to say in these terms, I want to ask all of you first. Malaysia, we can simply hug kisses and out and hug and kisses outside,
Oh,
right?
it's the
And kisses.
our.
Okay.
Yeah, I can
And
understand that. I can understand that.
So maybe even as a friend, we're not simply to do that, right?
mm,
So,
Yeah, when we meet people, we hug, we
uh,
shake hand. That's right, can.
but in certain country, they are not used to social distancing. They are very physically affectionate. Hugs and kisses are common not just among family members, but also
Yes.
friends and even work colleague. You know,
mhm.
even when they're just chatting, they are closer together. So yes, we cannot blame them because that's their culture, right? So
Yeah.
the
Yeah.
culture, physiological perception of personal space is smaller than in our countries. So, but maybe what we can they do actually for now is get the new normal for health and security reasons.
Yeah.
Mm. So next reason I think is overconfident. You know, overconfidence was
Overconfident.
an yeah overconfident.
How
Overconfidence.
overconfident can be connected to spreading of virus
Uh,
COVID-19?
overconfidence was a threat shared by certain country. The causes they got so many cases daily because
Mm.
they trust the virus will not spread because the involved countries so too far from them, right?
Mhm.
Yes. Yeah.
So then they don't know how fast the virus could push the healthcare system of the verge of collapse. I think.
Sorry, Mr. Ekemos. Sorry for
Yes.
interrupt.
Okay.
So I have question.
Yeah.
So do you think government should play an important role to fight COVID-19? Is it important to
Yes.
government? So how
Yes.
is it?
Absolutely, Miss Sufiana.
Yes.
Government should play an important role, but citizens also should give a good cooperation, right?
Okay.
And yet,
Yes.
most people think, or at least the government is doing a good job in face of COVID-19. And
Mhm.
I don't want to focus or take any country for an example in this issue, but yes, certain country is too late to prepare. Yes, too
Mm-hmm.
late to prepare means
Yeah.
too late
Yes. That's
means too
true.
late
Mm-hmm.
implementing travel ban, too late movement order, and other
Mm.
switches. Whatever causes will be spread the virus. There was not marshalling a strong response to this crisis, and maybe yes, they already done implement, but too late. It is too late, you know, and of course the disease was already spreading throughout the country. Uh,
So I just think that Mr. Nazri maybe have question to Mr. Mus. Mr. Nazri, how about you?
do you agree, Nazri?
I think I am agree. And for me, Malaysia is the best country and should be a role model for another country due to fight COVID. COVID-19.
Yeah,
Guys,
exactly, Nazrie.
we need
That's
to go
good
fast.
idea.
Guys, sorry, we just have 5 minutes here. The Webex is like,
Oh, sorry.
yeah.
Exactly,
Okay,
Nazrie. So,
continue, Mr. Mus.
okay, so in the fact, and the fact is Malaysia ranked as top 5, and people acceptance of the government actions received recognitions in a global survey where Malaysia was ranked among the top 5 countries with the highest public approval. We should proud of that, and I'm proud to be Malaysian. Thank you.
Okay, thank you, okay, Mus. So because of the time, so we next to Mr. Syahridon, please, Mr. Syahridon.
Alright, I already know the questions. Is it reasonable to when the government nation restrict our nation border during COVID-19? For me, it's yes. Like the COVID-19 pandemic spiked in Malaysia is March 2020, right? So the current statistic
Yeah.
from the Ministry of Health, like we have been mentioned earlier, through the implementations of the Movement Control Order (MCO), has
Yeah.
succeeded in controlling the spread of the
That's right.
disease within the country. The pandemic has brought about an influx of illegal foreign workers and immigrants, representing a significant challenging for Malaysia. Like, remember what happened in Singapore? Luckily, it's not happening in Malaysia as bad
That's
as
good.
Singaporean. Yeah. And then the two scenarios have led the Malaysian government to focus on border, security enforcement, and pandemic. Okay, first rapid
that's good.
social economic developments has made Malaysia a major focus for foreign workers with rising labor needs in the various sectors such as manufacturing, construction, and agriculture. The influx of illegal foreign work has increased, however, due to the limited access to healthcare and sanitation system, the possibility of these workers being infected with the new coronavirus now created is livelihood of the local population. But luckily, our government has been tackle all the problem of the illegal immigrants that work in Malaysia. Now, you remember the Rohanias immigrants? So it's been tackled also.
Oh, yeah.
Uh-huh.
Yeah.
They are one of the cluster. You remember the cluster? They start from a public cluster, and then there's more cluster and cluster and cluster and cluster. Yeah, a lot of cluster.
The means the started for the big cluster, is it?
Yeah. Okay. What I can just share with you guys, as far as I can, if we terminated, it means the sensation is end by the website. Okay. Yeah. In Skala Malaysia, the east coast of Sabah has along the inland border of Sarawak means the involvement and cooperations of the personnel and assets of all security enforcement agencies. The country's border on land and at the sea have been tightened and prevent both illegal entry and the spread COVID-19 in Malaysia until today. That's what have been informations by the immigrations members lah, since I'm working in government side, right? So I think
Is it all?
is it
all?
Sorry?
Is it okay?
Yeah, I think is it good information for you guys?
Yeah, that's enough for me. Enough for me.
Okay, I
Okay.
think
Time to
we have done very good in our discussion.
So
Yeah.
thanks everyone.
Thanks
Thank
everyone.
you.
Thank you. All information is very good.
Bye-bye.
And helping me also to complete my LDK4. All the information is here. Okay. Alright
Okay,
guys.
thanks.
Thank you.
Okay guys.
Right.
Stay safe.
Assalamualaikum. Stay
See you
safe.
again.
See you tomorrow.
Stay safe, stay
Tomorrow
home.
kah?
Always wash
tomorrow
your
lah.
hand.
Yeah.
Thank
Okay.
you.
Assalamualaikum.
Waalaikumsalam warahmatullahi wabarakatuh.